A newly formed group that advocates for the homeless wants data published by Public Health about frostbite amputations and deaths by hypothermia. CTV's Alana Everson reports.
Conditions are wet and cold at the Energy Court encampment site after rain and snow over the past 24 hours. Puddles surround many tents people live in. Holland Marshall is leading a new effort to get data relating to frostbite amputations and hypothermia deaths published by Public Health.
Getting your feet wet. In World War I, that was called trench foot. And that name has seemed to stuck. But what happened is we had rain now. After we had snow and it's cold, we have rain. And if you think it's better, no, it makes everything worse because your sleeping bags, your clothing, your socks, your shoes, your pants, everything gets wet.
Marshall has reached out to Sudbury MPP Jamie West, who feels publishing this type of data would be helpful in assessing the needs of the homeless population and the challenges people face.
We had the meeting with Holland last week. Right away, my team in Queen's Park has reached out to the Legislative Library to find out what happens in other provinces so we can take a model that they have to share here in Ontario. We're also going to be speaking with Public Health to make sure they're able to work with this data because we know that they had funding cuts as well, so we want to make sure this is successful all the way around.
Marlon Wright has been homeless on and off for several years. He lost his fingertips in Regina and some toes in Sudbury due to frostbite.
It's painful, like severe frostbite. Like when that happened to me, it was extremely painful. Like the morning when I got into somewhere warm, it felt like it was being burnt. Like it was burnt or you slam your hands in the car door or something like that. That's what it feels like, but it's continual.
Marlon stays in the shelter overnight, but says days can be cold on the streets, getting to places to get warm. In an email, Public Health Sudbury and Districts says it does not have access to data on cold-related injuries, but supports this kind of information being centrally collected and made public. Alana Everson, CTV News, Sudbury.